Hello, I'm Ray Upchurch, and you're watching the Trey Hart Learning Channel. Today, I'm briefly going to be talking about the management of heart failure, with the focus being on how to manage your medications. So, what do I mean by self-management? One of the best ways you can feel in control of your condition is to learn how to self-manage your condition, understand what it is, and how you can control your symptoms. While some will be overwhelmed when they have been told that they have congestive heart failure, not everyone is. So, if you're overwhelmed, take it one step at a time. So, what are the steps to self-management? Well, the steps to self-management involve being able to recognize your symptoms by learning about them, what works for you, and why it works. To also be aware of the changes in your symptoms. Part of self-management means knowing when you need the help of others and seeking it out. Maintaining your blood pressure, eating healthily, keeping active, limiting your alcohol, and stop smoking. Now by this, I mean e-cigs as well. The nicotine in e-cigs can cause severe constriction of the arteries, more so than cigarettes. So they may not contain some of the associated carcinogens that are associated with cancer, but will increase your chances of heart attacks and strokes. Excuse me. So there is tons of information for people with heart failure. This video for one, but there are also other sources of information for you. One of the things you can do is check out the British Heart Foundation website and the American Heart Association website. If you don't live in one of these countries, do an internet search for the one in your country. So, let's talk about some of the medications typically used in heart failure. Typically, most heart failure medications are given to reduce the workload of the heart, but this does not apply to every medication used in heart failure. Some medications are used as preventatives, such as warfarin, which is an anticoagulant typically used in patients with atrial fibrillation to prevent blood clots, or simvastatin, which is used to lower cholesterol and may reduce the risk of heart attacks and stroke. One of the things that you will quickly learn when starting any of the medications is that the doctor may make several adjustments before finally settling on the dose of your medications. Now, I know that this process can be unsettling, but it is necessary. The reason for this is so that you can be on the dose that is correct for you. Some of your medications will be started at a low dose and titrated up to the maximum tolerated dose or the maximum suggested dose, whichever comes first. So what does this mean? Well, some medications such as ACE inhibitors, ARBs, beta blockers, while the science shows that they are all beneficial, it also shows that the safest way to use these is gradual titration. Because everyone is different, you may be only able to tolerate a low dose without any adverse side effects, such as symptomatic hypotension and renal problems, which means that you're at a maximum tolerated dose, but not necessarily the maximum suggested. One of the most common and one of the first medications used in heart failure is diuretics. Now, when I say diuretics, they're sometimes referred to as water pills. I mean medications such as furosemide, bumetanide, furosemide, metolazone, hydrochlorothiazide, spirolactolone, and amiloride. Just to mention a few, there's obviously more diuretics out there. So what do diuretics do? Well, diuretics work with your kidneys to get rid of excess fluids. That means that you will have less swelling, less breathlessness, and they also help to lower your blood pressure. One of their benefits is that they work with ACEs and ARBs and beta blockers and help them work better. So what are the side effects? Because they help the kidneys to get rid of excess fluids, they can cause hypotension or low blood pressure, which may lead to dizziness. Sometimes they may cause gout or cause gout to worsen, but gout can be treated. They can cause you to go to the toilet more during the day and sometimes at night. So what side effects should you tell your doctor about? Well, because diuretics are meant to help you pass more urine, if you start to do the opposite of this, meaning you start to pass less urine or are having difficulty passing urine, then you definitely need to let your doctor know about this. Now, diuretics may cause and can cause constipation, which should be reported to your doctor. And as they lower your blood pressure, any new dizziness or feeling lightheaded should be reported to your doctor. So what else do you need to know? Well, diuretics can alter mineral salts and the water balance and make you pass loads of urine. So it's best to take them in the morning and afternoon if you're prescribed more than once a day. If only once a day, it's best to take them in the morning. Try not to take them at night because the increased urination will cause you to lose sleep. Basically, you'll wake up having to go to the bathroom. Talk to your doctor about reducing salt, and do not increase your salt, as having too much salt may cause the worsening of fluid retention in the body. You should also avoid taking things with increased potassium, unless it's prescribed by your doctors, which sometimes it is with diuretics. Beware of becoming dehydrated. As I've said in another video, you should drink the maximum amount of water allowed to drink by your doctor. So you need to use caution in conditions that are hot and warm, and always let your doctor know if you have unexplained weight loss, diarrhea, fatigue, increased thirst, or new onset of dizziness. One other thing, if you are a diabetic, please note that diuretics may increase your blood sugar. Now, typically with diuretics, the aim is to have you on the least amount possible to manage your symptoms, and preferably on none or as an on-needed basis. So you need to be aware of how to take them and when to take them, and most importantly, to take them as prescribed. I cannot emphasize how important it is to take all of your medications as prescribed, as diuretics are one of the medications that is most often not taken by patients because of the inconvenience of having to go to the toilet more often. So this often results in a worsening of the symptoms, such as breathlessness, the increased edema. And so when you have a follow-up with your doctor and you have a worsening of the symptoms, the doctor will usually increase your dose of diuretics, not knowing that you're not taking the medications as prescribed unless you mention it to them. And most patients don't let the doctor know they're not actually taking them as prescribed. So, will there be a time where I won't be taking diuretics? To answer this is based on your symptoms. And if diuretics aren't used, doctors will usually prescribe them on an as-needed basis. And if they're not used for several months, then they might stop them. But you should immediately let your doctor know if any swelling or breathlessness returns. So what do I do if I've never taken diuretics or I've never been prescribed diuretics? Well, actually, that's great and it's fine. But if you do notice breathlessness or swelling in your ankles and your feet or your stomach, be sure and let your doctor know. Lastly, when you are on diuretics, frequent blood checks can be expected. That is normal. Well, thank you for watching. And if you have any questions, post a comment. I will answer it. Next time, we will continue our talk about heart failure and the medications associated with heart failure. My name is Ray Upchurch, and I'll see you then.